Welcome to our presentation on making sense of sensory processing. This is part 4 with strategies on how to help with self-care at home. This module will provide sensory strategies to help children and young people with self-care activities at home. Let's have a quick recap. So, sensory processing refers to our ability to take in the sensory information from the world around us. Our brains then organise that information and turn it into a meaningful response. We have 8 senses. They are hearing, taste, smell, sight, sometimes called vision, touch, which is sometimes called tactile, our sense of proprioception, which is where our body is in the space around it, our vestibular sense, which is our sense of movement, and our sense of interoception, which is what's going on inside our body, for example, needing to use the toilet or feeling hungry. Our brains can be over-responsive, under-responsive, or need to seek out sensory stimulation. And sensory sensitivities, whether they're over-responsive or under-responsive, can impact upon our behaviour, our learning, and our ability to play. Sensory processing and everyday activities. To complete the activities we need and want to do, our brains have to take the information from our senses and turn it into an action. Physical and mental health and developmental conditions, so things like autism or dyslexia or dyspraxia or cerebral palsy, can all impact how our senses are processed and how we regulate our feelings and emotions related to this. We're going to talk a little bit more about regulation, but if we struggle to process our senses, we can struggle to do everyday activities. Self-care is one of our activities of daily living. There are many aspects to self-care, and they can change dependent on the person's age, their developmental stage, and expectations on them. For this purpose, we are going to use washing, teeth cleaning, hair care, nail care and shaving, using the toilet, eating, dressing and communicating needs, and explore strategies to help each of these areas. So what sort of sensory sensitivities might you see when it comes to self-care? Well, of course, all children and young people are individual and will have their own individual sensitivities, but these are some of the more commonly seen issues. Some people are very particular around certain textures of clothing, and they may dislike the feeling of labels or seams in their clothing. Some people can get muddled when they get dressed and not understand which order the clothing needs to go in or whether the clothing is straight or not. Some people have sensory sensitivities around food and would only enjoy a limited range of food, or they may not like foods to touch on their plates. They may struggle with coordinating a knife and fork, or struggle to know when or where the food is on the plate and tend to get very messy when eating. You may find that they have sensitivities to teeth cleaning, hair washing, or having their nails cut. They may be quite reluctant to get in the shower or bathe. They may be very sensitive to the scent of products. They may even be fearful of using the toilet. So how can we support self-care skills in children and young people? Well, here's where you get to use your sensory detective skills again. So be curious, look at what's going on for that child. What sensory sensitivities are impacting the child? What changes might you be able to make to the environment or the task that you're asking them to do? Think about what might help and what hinders success. Let's take a look at teeth cleaning. Lots of children find teeth cleaning difficult. They may struggle to complete the task independently. They may struggle to remember to start the task. They may find the sensory sensitivities involved in toothbrushing too much to cope with and get quite upset when it comes to doing it themselves. So first of all, we need to look at what style of toothbrush the child will tolerate. There are lots and lots of different types of toothbrush, and often electric toothbrushes are tolerated better than manual toothbrushes. What sort of toothpaste will your child tolerate? If they struggle with the minty taste of regular toothpaste, there are fruit-flavoured and neutral-tasting toothpastes you can get that are available from a range of online retailers. If your child is struggling to cope with a regular toothbrush, there are even toothbrushes you can fit over your fingers, and three-sided toothbrushes which reduce the amount of time taken to brush the teeth. Some children find that when they have to tip their head back to brush their teeth, the bathroom light, if you're brushing your teeth in the bathroom, is too bright for them. Try turning this light off or turning them away from bright windows. Using timers, visual aids and mirrors can also help the child or young person to brush their teeth. It's very important to be consistent and predictable to reduce the anxiety around toothbrushing, and remember to visit the dentist regularly, not only to keep teeth healthy, but to ensure that children understand the importance of regular checkups. Lots of children with sensory sensitivities can find hair care challenging. This could be hair cutting or styling, or it could be washing the hair that they struggle with. It is often dependent on style and fashion, and the culture and age of the child. Often visual supports and social stories can help the child or young person understand the importance of hair care. Using proprioceptive inputs such as deep, firm pressure through either specialist hairbrushes or scalp massages can also help reduce the sensitivity. Try using detangling products. Encourage the child to get involved in their own hair care. Using play and distraction can be a great tool when taking the child to the barbers or hairdressers. And using snag-free hair ties and hair accessories can reduce the amount of scalp sensitivity when it comes to restyling the hair. Nail care and shaving. Let's start with nail care. Lots of children with sensory sensitivities find nail care challenging. Try different types of clippers or scissors to work out which is best for your child. Sometimes applying pressure to the nail before cutting it can reduce the sensitivity. Try cutting the nails on the edge of a table, with the edges of the fingers pressed into the table. Let's look at shaving. So shaving face hair and body hair is very dependent on the person's age and cultural expectations. It can feel quite daunting as a parent to let your child loose with a razor. So if you're struggling to maybe come up with different solutions for this, talk to your child about what they would like to use and then provide the tools for the job. Using different razors, electric razors or epilators may help. Hair removal creams can be very useful. Set up a mirror and have somewhere for the child or young person to sit or lean against. Using social stories, visual prompts, routines and videos can help, and there are lots of different apps now available to promote self-care with teenagers. Using the toilet. Lots of children with sensory sensitivities will have difficulties and issues using the toilet. These may be different issues dependent on their age and their developmental stage. To begin with, make sure their position is correct on the toilet. Ideally, they will have their feet supported by steps or on the floor, and a toilet seat that is the right size for their bottom. If your child is struggling with wiping, using wet flushable wipes can help. Sometimes visual supports or social stories can help them understand the sequence of events and why it is important to keep clean and use the toilet. Some children find reward charts or sticker charts very motivating. Some children struggle with wondering whether the toilet will splash when they use it. If this is the case, you can try using a little toilet paper in the toilet to reduce the amount of splash. If your child is not showing signs of toilet readiness, it can be difficult to know when to try and encourage them to use the toilet. There's specific advice for autistic children and children with developmental difficulties at the end of this presentation. The important thing is to start to use pre-toileting skills. That is, that you change nappies in the bathroom, that you learn to wash hands, and that the child understands that the bathroom is a place to use the toilet. Let's take a look at strategies to help with dressing. First of all, everyone has clothing preferences. Everyone will have sensory sensitivities to certain clothing, but sometimes those sensory sensitivities will get in the way of us being able to wear what we want and need to wear. Things like labels, textures of clothing, themes, and even the colours sometimes can be very difficult for some children to cope with. Visual supports can really help with this. Understanding why it's important to get dressed into things like school uniform, or the sequence of getting dressed, written in a pictorial form like on the right, can be very helpful. You can also adapt clothing. If a child is struggling with, say, a drawstring pants, you can use little toggles on it to help tighten the pants. You can add markers to whatever side of the clothing needs to go at the back. Always try and get dressed in a low distraction and calm environment. Sometimes this is easier said than done if you have lots of other children in the house, but trying to keep a nice, calm environment will help the child's anxiety stay low. Clearly labelled storage and items of clothing laid out in the order that it needs to go on can also be very helpful. Some children will prefer tight-fitting clothes, whereas others prefer loose-fitting clothes. Work out what works for your child. Having somewhere to sit or lean against can also be very helpful when dressing. Some children find using a mirror also very helpful because they can adjust their clothing as they need to. When supporting a child or young person with their self-care needs, communication is key. Now, communication is a two-way process. So if your child or young person struggles to communicate verbally, there are lots of different strategies you can use to help them communicate more effectively. This might be through AAC or using social stories or visual supports. If your child has a speech and language therapist, you can ask them for support with this. Things like now and next cards can help reduce the amount of pressure on the child because they know what it is they're supposed to do now and what comes next. There's lots of apps and technology available to help support children and young people with self-care routines. I'll pop some links to different apps in the end of this presentation for you to explore. Remember, if your child is communicating to you that they're upset, they may be trying to tell you that their sensory preference is that they're not happy with what's going on. So I suppose a good example of this is a child getting upset if their food touches on a plate, or a strong reaction to a taste of certain toothpaste. Your child probably isn't doing this to be awkward. They're trying to let you know that the sensation is just too uncomfortable for them. Use your sensory detective skills and see what it is about the task that you can change. What are your child's priorities and what are their goals? Are they the same as yours as a family? If there's some differences, what can you do to help communicate more effectively with each other? Teens and self-care. Teenagers may have strong feelings around self-care routines. Some teenagers may be very particular about their self-care routine, whereas others may be not as motivated to get involved in self-care routines. If your child or young person has sensory sensitivities, they may find self-care routines particularly difficult around puberty. So here's where you get to use your sensory detective skills to find out what motivates your young person. There are lots of different apps and technology-based resources that can help children and young people sequence activities that they need to do for their self-care. It can prompt them to do the activities, for example, putting on deodorant or having a shave. There are lots of different tutorials on YouTube and Instagram, and often young people prefer to find a role model that they find inspiring and copy some of their self-care routines. Social stories and visual supports can also help. Menstruation and sexual health. Learning to look after your body is an important part of growing up, and coping with puberty and periods can be very challenging if you experience sensory sensitivities. If you're a family member or adult supporting a young person who is going through puberty, try to start early with discussing the changes that are going to happen to their body, trying to use the correct terminology for each body part. There are lots of different products that can help with menstruation. There are menstrual cups, pads, tampons, and even special knickers that just look like regular knickers. Visual supports and social stories can really help a child or young person understand why it's important to stay clean and look after their body during puberty. It's also very important that they access sexual health education so that they understand about their body and the changes that are happening to it. This slide contains resources and suggestions to help with self-care activities. Please note that not all the resources listed will be suitable for all children. Please consider your child's needs when deciding which activities might help them, and assess the risk of whether these activities are suitable for them. If you require further advice, please contact the ISCAN Occupational Therapy team. It's also worth noting that some of these links are to external websites and may be subject to change. So let's start by looking at washing. Washing makes up lots of different parts of our self-care activity. There's regular washing of the hands, there's washing of the face and of the body. Now, children may find it difficult to wash themselves for lots of different reasons. They might struggle with the sequence of the activity, so what comes first and what comes next. They might dislike the feeling of water on their face or a particular flannel, or using a particular brand of soap because of the texture or the smell. So it's important to use your sensory detective skills and work out which bits of the task the child is struggling with. Some things that can help is using visual prompts or visual supports. Songs and repetition about how to wash or going through the washing process can help. Having an adult demonstrate and do the activity next to you. Sometimes using liquid soap rather than solid soap helps. When it comes to drying hands, try using towels rather than hand dryers. Many young people really struggle with the sound and sensory input that comes from hand dryers. If you are in the bath or shower, try letting your child hold their own shower head rather than you hold it. Sometimes children will tolerate baths rather than showers. Try using deep, firm pressure when drying or washing. This isn't firm enough to hurt the child, this is firm enough to increase the proprioceptive input to the child. Now remember, if you're struggling with what proprioception means, if you look back at the other presentation, you can get more information about that. Some children find different coloured products or different smelling products more preferable. Using water shields or shampoo shields can keep water and shampoo out of the eyes. Sometimes no tears products can help. Sometimes social stories can help us understand why we need to engage in the process of washing and washing our hands and our face and our body and staying clean. Eating and meal times. This is one of those activities where positioning makes a big difference. If you can sit your child at a dining room table on a chair that's an appropriate size for them, with their feet supported, chances are they will do much better at using cutlery and eating more effectively. There are plenty of different seating options you can get from online retailers and places like IKEA. The important thing is that your child's feet are supported. This will help them be more stable on the chair. Next comes cutlery. Some children really struggle to use cutlery and would prefer to use either one item such as a fork or a spoon or their fingers. Using cutlery can feel a little bit stressful for children during meal times because they're likely to be hungry. You can play with cutlery using Play-Doh. You can choose different types of cutlery. There's special adapted cutlery that will be linked at the end of this presentation. Any bowls, plates or cups should be stable and not easy to tip. When it comes to emotional regulation, try and stay calm and consistent during meal times. It can be quite a tense experience for everyone if your child is a particularly picky eater, but by staying calm, you'll show your child there's nothing to be anxious about. Minimal distractions can help as well. Try turning the television off and moving away from other distractions. Using visual supports, picture menus or timers can also help. Motivators such as sticker charts and rewards may also be helpful. Involve your children in the preparation of food so they're less anxious about what's gone into it. And if you're trying new foods, introduce one food at a time.